All right. In fact, Vipin, we leave it at that. Thank you very much for joining us with those updates. Now, amidst the rising COVID-19 numbers across the country, Gulbarga Institute of Medical Sciences has set up a 25-bedded COVID-19 ward as a precautionary measure. Talking about necessary preparations, Medical Superintendent at GIMS Hospital, Kalaburagi, Dr. Shivakumar CR has said as per the guidelines of the state government, Health and Family Welfare Department and the Medical Education Department, we are fully geared up with a set of 25 beds, of which 5 beds are in the ICU with ventilators, 5 are high dependency units, 5 are for pregnant women and patients requiring maternity services, and remaining 10 are general beds. We have a labor room and an attached operation theatre. We have sufficient oxygen and we've deployed adequate human resources, quote unquote. These are, of course, the big updates coming in from Karnataka. In fact, let me quickly join Belly Thomas for more on this story. Belly, an emergency ward being set up in the state. Is this due to the rising COVID-19 numbers?
Absolutely, Uday. This is based on the guidelines issued by the state's health department. What you saw is in Kalaburagi district, the Gulbarga Institute of Medical Science have put up a 25-bedded exclusive COVID ward where 5 beds are dedicated for the ICU patients and 5 beds for patients requiring high dependency units and 5 for pregnant women and women needing maternity services and 10 local beds. There is a labor room and surgery room, operating room attached with that, and all the human resources have been mobilized, and along with this, the equipment, the infrastructure like ventilators, the oxygen supply, and other antiviral drugs are also stocked at the hospital in sufficient amount. A good number of RT-PCR kits are being stocked at the hospital for increasing the number of tests. So as of now, the Karnataka stands at 324 cases that have been at present active now, and 53 active cases had come in the 24. And the state had a cumulative number of COVID patients, which is around 524 since January 1st of this year. And there have been 254 patients who have been recovered and discharged. So among these 324 patients, around 219 patients have been asked to be isolated at home, and they've been sent home, while 4 of them have been, I beg your pardon, 5 of them have been admitted to hospitals due to other comorbid conditions. This is what we get to know from the health department.
All right. As far as the COVID-19 numbers in the last 24 hours are concerned, how many more cases have been reported and any fatalities?
A total of 4 people have so far died in the state of Karnataka. And
what about the last 24 hours? What is the spike been like?
Over the past 24 hours, 53 active cases have come up in the entire state, and a total of 324 patients are active, so far active in the case. And over the past 24 hours, 625 COVID tests have been conducted on patients, in which 53 has come out active. A lot of people, due to the monsoon setting in, have SARI and influenza-like illness symptoms for which tests are being conducted on them. But however, there are only 53 patients that were tested positive over the past 24 hours among the 625 tests that were done at all the government hospitals across the state today.
Belly Thomas, thank you for joining us with those updates. Chief Justice of India B.R. Gavai along with Justice Vikram Nath has joined